Welcome to the MS Gym podcast. I'm your host, Jody Feltham, and it's about to get real as we listen to the victories and struggles of our own MS Gym members. So let's dive in. The MS Society website tells us that Canada has one of the highest rates of MS in the world, with an average of 77,000 Canadians living with the disease. MS can occur at any age, but is usually diagnosed between the ages of 20 to 49, which are the peak years for education, career, and family building. I'm excited for today's guest as she will tell us all about her diagnosis and how she navigated through the waters of career, marriage, and raising two young children. Hi, MS Gym family. I am so excited. This is my first podcast today, and I am so looking forward to talking with Melissa Hayes about her journey with having MS and raising a young family. So please welcome Melissa. And again, Melissa, I'm so glad you're here today.
Oh, Jody, thank you so much for asking. I'm really excited to be here as well.
All right, so I hear little voices in the background, and I'm sure we'll hear a few more. But that's exactly what the episode today is all about. So, Melissa, why don't you tell me kind of about how MS started in your life?
So I was 23 years old. I had just finished university. I had my first job. I used to work as a reporter, so I was working in a fast-paced newsroom. What happened to me is all of a sudden my eyesight got blurry. I didn't wear glasses at the time. And I went to the optometrist, and they told me that my vision was perfect. And I was like, but I can't read what is on the wall. Like, I can't read those letters. And they said, it's a brain thing. It's not, we don't think it's anything wrong with your eyes. We think it's something to do with your brain, and you need to see a doctor. And so that was like quite the shock. That was kind of the start. Then I had facial numbness like 2 weeks later. So it was like bang, bang, bang. And as a young woman at the prime of her life, basically, just starting her brand new career, to be told that I likely had MS, like that was just kind of very eye-opening and very, we didn't know what to expect. I didn't know what MS really was. All I knew about it was that it could put people in wheelchairs. That's all I knew about it. And I was young and wasn't sure what it would look like for me, and wanted to not think about it, really. Wanted to not think about it. So what happened for me, and I'm sure many of our guests, when they think about how their MS journey began, for me, when I had relapses, they would last for almost 3 months on the dot. And after the 3 months, the symptoms would largely disappear, and I would go back to being my normal self. I've had quite a few relapses. So I've had MS now for 13 years. And I think I've had 10 relapses. So one a year, pretty much. I think the longest period now. So I started on new medication 3 years ago, and I haven't had a relapse since I've been on my new med. But to have had MS for so long, and I always had a relapse, and then I'd bounce back basically until I did it. And that was 4 years ago. And that was before I found the MS Gym. And thank God I found the MS Gym. They've, like, honestly, these exercises can change lives, and they've changed mine. So, and my family's.
That is so awesome. And you already answered some of my questions that I was going to ask. So you said, so 13 years is a long time, and 23 years old is a big, it's a big burden to carry at that young of an age, right? Like, kind of the stats say around like 29 is the average age, but like 23, 6 years earlier. So it's like you said, you just got your career and you just got started in it. And you say we, so I'm wondering, was that when you were married at that point, or you were with your now
I
husband?
Yeah, we were already dating at the time.
Oh,
So
okay.
we had already been dating for a couple of years, and he was with me um, through all the unknown. And now we've been married for 8 years, but we've been together for, I think, 16 or something like
Oh.
that. And like I said, how I chose to deal with it at that time was to not think about it.
Hmm.
Yeah.
So you mentioned, you said everything, you'd have a relapse and you'd come back and then you could get back on with your life. But you said 4 years ago, it didn't, things changed for you. So can you tell me a bit about that?
Yeah. So I already had my son. He's 6 now. He just turned 2. We were trying to have another child. Um, so I went off of my MS treatment at the time. So that was 4.5 years ago. There was only one drug that was considered safe. And I had already been on that drug and I was allergic to it, so I couldn't go on it. So under my choices, I said, okay, I'm going to go off of medication completely. That's what I did when I had my son, when I got pregnant with him. I'm going to do it again. I felt great. I was on Gilenya at the time. I
Mm.
felt great. My neurologist cautioned us that that might not be the best choice. My MRIs showed progression. Like every year, I had more progression on MRI, even though my physical symptoms and my clinical visits were good. They didn't change that much, but on my MRI, you could tell that the disease was actively progressing all the time. So he wasn't a fan of the plan,
Mm.
but that was what we wanted to do. So that's what we did. And I was feeling great. I hadn't felt so great while I've had MS. So we decided to try. So I was off of the drug for 10 months.
All right.
Um, and then I had a relapse. I was we were going for a weekend away um, to kind of just get away, have a nice weekend in the mountains. We live in Alberta in Canada, so very close to Banff National Park, for example. So we were headed towards Banff, and I was itchy. I had like a really itchy scalp, and I had never experienced that before. And I just thought, like, this is weird. The next day I woke up, my whole right side was numb and I had lost feeling. And I hadn't experienced a relapse like that before. Um, we came back from our trip away. Um, and like most people know, like when you have a relapse like that, it gets worse. Like in the next 2 weeks, it can get worse. And it did. And I couldn't walk. I couldn't stand. I couldn't go up the stairs. I had a 2-year old at the time. Um, I couldn't do a lot of things. 2 months after that relapse, I had another one. This one affected my left side. Um, so I couldn't lift my left foot high enough off the ground to put my underwear on. Like I could not lift it off the ground. So I was still unable to move because of my right side. And now my left side, I couldn't lift my foot off the ground. And then in March, so in a total of 9 months, I had another relapse. So instead of having a baby in 9 months, I had 3 relapses that were quite serious. The third one was to do with my eyes. So we started by saying that that was my first symptom. I had optic neuritis. Um, and this kind of came back, not the same optic neuritis, but I had pain. I couldn't look at screens. I couldn't have bright lights around. Like I just had to be very careful with my vision, probably for like a month and a half.
You've talked a lot about your physical symptoms. What about cognitive issues?
With my relapses, like they caused a lot of physical problems, like we've talked about, but they also caused a lot of cognitive problems. They caused like so much fatigue. I had to take a nap 2 to 3 times a day, plus get a good night's sleep. So I was in bed almost all of the time. I couldn't handle loud noises. I couldn't handle conversations. I couldn't follow them. Um, there were it was very hard on our family. And so I was a stay-at-home mom and I couldn't take care of my child. We decided to put him into daycare 4 days a week. I still wanted to have him 1 day a week by myself, which was important to me. He was the only thing that made me smile, that gave me laughter, that gave me joy. Like that was the only thing that kept me going with him. And then when I had that third relapse the next March, it was the worst neurologist visit of my life. My husband and I had another MRI. I had been back on the Gilenya since August. It wasn't working. So it showed more active lesions, more progress on the MRI. He had been surprised I hadn't had a relapse yet. Well, the stress of that visit sure brought that relapse on really quick after that visit. And when we were there, like I remember crying in the doctor's office. And after the appointment, we stayed in that room for a little bit. And I said, I can't have Connor at home for that 1 day a week. I can't have him at home. I am hurting myself. I'm hurting us by trying to do this. He can go back into daycare. He's got his friends, and I can focus on getting better and getting through this so that I can be present. Because when he's at home and I've been with him, I can't be as present as I want to be. And that was the hardest decision of my life, to decide that, to admit, I guess, that I couldn't anymore. I wanted to with everything I had, but I knew after that very sobering appointment that things were possibly going to get worse. And I was bringing it on myself as well. So because I was trying to keep pushing through it. Trevor talks about that neural edge. I didn't know that then. So we didn't have an MS gym then. And I would constantly push through the neural edge all the time. And that was my problem too, was that it was just this never-ending cycle that I would go through. And I'd hit that neural edge, I would burn through it, and then I would take a little bit of time to recover, and then I would go again. And that's how I lived my life with MS since the beginning.
It really sounds like an exhausting cycle. And listening to your journey, it's really obvious to hear that emotion still in your voice. And I know that many of the listeners will be able to empathize with your situation. And, I'm glad that things did transition for you, but that would have been really difficult for you, you know, putting your son in daycare and realizing that you needed more help than you initially thought. And not only that, you were hoping to get pregnant and bring another life into the world, and yet you had 3 relapses. So there was a lot on your plate there.
I also should mention that at that appointment, when we decided, okay, we're going to put our son back in daycare full time, like 5 days a week, and no more of this 4 days a week stuff. We kind of made the realization that we weren't going to have another child. We were so sad because we thought, when you get diagnosed with MS and you think, okay, how is my life going to change? Mm-hmm. Right? Especially when you're that young and you're told by the doctors, no, you're still going to have the full life that you are expecting. And all of a sudden it feels like it's taken from you. And I was at a point where my body didn't work anymore.
That's a really hard place to come to. And I'm sure it was so devastating realizing you might not be able to have another child. But thankfully, that's not the end of your story. In fact, you've got some pretty big news to tell us.
So I have now an 8-month-old daughter. So how my life changed so much in that 4 years. 4 years ago, if you asked me, where do you see your life in 4 years? This is not where I saw it. This is not where I saw it. And oh my God, every day I write down my gratitude, and every day I think about the MS gym. I think about my medication. I think about my family and my health, and how amazing it is that I can be living a life where I have my 2 kids, where I have the energy to play with them, where I don't have to have 3 naps a day, where I can have a conversation with my husband. When he comes home from work, I can ask him about his day and follow it and not tell him, okay, that's a little bit too much right now, and just shut him down.
That sounds so incredible, Melissa. And, sometimes when we go through really hard things in life, we have such immense gratitude. And it sounds like you live every day in that gratitude, and you certainly don't take a single thing for granted at all. And that's a gift. And that obviously shows, that's a growth too in your character too, that you live in that gratitude. So I want to learn a little bit more. You've talked about the MS gym and what a monumental piece that's been in your life. When did you find the MS gym?
Well, I found the MS gym at the beginning of January in 2018. What happened? How I stumbled upon them. I decided to start going to a local MS support group in town, and they were talking about exercise and how important it was, and it is. Mm-hmm. And I was at a loss because exercise, in my mind, I used to be a competitive swimmer. So exercise, in my mind, didn't match what I could possibly do because I could barely walk. So how is that possible? So I was 18 months post relapse at the time, and my relapses, I was still dealing with everything except for the vision had improved. So it was my legs, my right side, my hand didn't work, and the immense fatigue. So how can I exercise? I came home, I had really connected with one of the men at the group, and I found him on Facebook, and we were messaging back and forth, and I said, this exercise thing, I'm really interested in trying to find something. Do you know of anywhere in Edmonton? We live just outside of Edmonton that has a place that can facilitate our needs. And he's like, there's this place, but I think you should check out the MS Gym.
Oh, yeah.
Search the MS Gym. What is this? Watch the intro video, like when him and Misty are talking about setting 1 million people free. Like, what the heck? Like, all of this time, I felt like I had been clinging onto hope, clinging onto hope that there was something else, that this couldn't be the end, basically. I had to get better. I didn't know who was going to help me, but I was ready to like do whatever I could to get better. The MS Gym on Facebook. And I look it up and I watch the intro video and I like connected with what Trevor and Misty were saying. I couldn't believe that they existed, that these people were saying what they did. And I'm like, okay, well, we'll see if this works, right? I had already mentioned that my hand didn't work. Couldn't write. I couldn't cut things. I couldn't, like I had lost so much of my dexterity and fine motor skills. I couldn't put makeup on anymore. Like that's not really like on my things that are important. That is not high at all anymore. But like all of these things that I couldn't do anymore, that I like had lost. So I searched in the search bar, hand, see what they had for hand. Found this video. I did this exercise, and all of a sudden, Jody, I had feeling in my hand, more feeling than I had in 18 months. What is this? So I came out of my room, was able to come out of my room, sat at the top of the stairs, and I called my husband and I was like, Alex, you gotta come here. So he came and I was like, I just found this thing on Facebook. Like remembering it now, it's crazy, right? I just found this thing on Facebook. There's exercises for MS and I just did it and I have, oh my God, feeling in my hand. It was just like, oh my goodness, like so emotional and so unbelievable and so incredible. And I remember we were so, and I just like, this guy, who is he and where did he come from? And thank you. Like, are you get like, where can you get me from here? Because I've done everything else that anyone has ever given me and it hasn't helped.
Yeah.
So we went out for dinner that night actually to celebrate that I found the MS Gym.
It definitely sounds like a pretty monumental moment. So, how did you go about incorporating the exercises into your daily life?
So I decided, okay, every day Trevor would upload an exercise, like a part of an exercise, and he would do explanation and information and knowledge. So all of a sudden I was learning what was happening in my body. All of a sudden I was learning this muscle, because it's tight, this other muscle can't work properly. This thing about neuroplasticity, what the heck is that?
So, it sounds like you're learning so much about your body and what it's capable of doing. When did you actually sign up for the paid membership?
Actually, I had a friend come over to visit me, and I was telling her about this MS Gym thing that was going on Facebook. And she was so happy for me. And I was saying, I'm really considering about this membership that they have. I am so glad that she was sitting here and she made me do it.
I'm sure your friend is so thankful that she gave you that extra nudge too. Tell us a bit about the improvements you've seen since you first began.
When I started, Jody, I could walk 25 to 30 steps before I needed to sit. I could stand for about a minute before I needed to sit. And I was so happy that I made it to, I could now stand for a minute, because that was like huge compared to like what I could have done like 6 months earlier. And now, oh my gosh, now I can walk 2 kilometers without foot trub. And like, how did that happen? It happened because of my medication. It happened because the MS gym taught me how to walk again. They taught me how to believe in the future. They
Mm.
gave me that hope, like they ignited the hope I always had. They made me believe that it was there. Um, if we talk about at the beginning of the MS gym, so Trevor's Motivation Mondays and Misty's Moments on Wednesdays,
Mhm.
um, those talks helped keep me focused and helped keep me motivated to keep getting better on those hard days, to have my why. Misty always talked about your why.
Mhm.
My why were my kids. Well, now it's my kids.
Mhm.
My why was always my son. I wanted to be able to play with him for longer than 5 minutes. Like, I wanted to not have him in daycare anymore. Oh my God, when I took him out of daycare,
Mm.
it was the best feeling in the world. It was the best feeling in the world. When I was healthy enough to try to have another child, it just, it's amazing. It's amazing to think how I got here, how I got here. And I'm so, so grateful. Like we talked about, like gratitude every day.
Mhm. That's incredible, Melissa. And I know, I remember you in kind of the beginning, and I remember seeing you first in some of Trevor's, he had some additional online training, and you were part of you signed up for this bonus kind of product. And you were, at that point, you were walking, your son was still kind of in daycare a little bit, and you were so excited because you said that you could finally walk and hold on to your son. And that sticks out in my mind. And just over the last year and a half, I think of all the victories that you posted about. You post, oh, I walked my son to the end of the driveway. I walked him to the mailbox. I walked him down the street. And like my heart just soared for you. And I know that so many of the other members, like we're all there with you walking down the street, like in heart and spirit. And that's another awesome thing about the MS gym, the MOC, is that we have become like a family. And we are all cheering for each other. And and it was so exciting when you posted, like, um just over a year ago, when you were expecting, like, that you were planning your second baby, and hearing your story, and just hearing the journey and the process. It seems like such redemption in your life, from the point of kind of giving up hope and not knowing what was going to happen, and your son in daycare, to now having, like, not only one but two beautiful children now that you can take care of. And it's so phenomenal. And I'm so glad for your friend that she prompted you, she like bullied you into signing up for the membership. She's kind of like an angel per se, or something, at that nudging in your life to get you onto the right course. So
Yeah.
so it's been so exciting. So what advice do you have for other young moms? Because I know you're one of many young moms in the MS gym. So what would you say to other moms out there that are really struggling, whether they have the magnitude of symptoms that you had before, or just trying to figure out a schedule? Because I can just imagine um, the stress of having like a newborn and not sleeping, or your toddler not being able to sleep through the night, and then suddenly being where in the world am I going to have energy to take care of them or myself? And what the heck does exercise, how does that fit into here?
Right, totally. And it's tough having a baby. I do have to say that my exercise, when I started exercising, I called it my non-negotiable. So I didn't make excuses. I had to do my exercise every day. I had to get them done because I knew I celebrated every single small victory in the MOC because I knew that they were so important and they were going to be leading up to this bigger victory of who knows what it was at the time, right? Yeah. How I did it was at the beginning, when I was dealing with so many of these symptoms, I had to put my son into daycare because I needed help. I needed that break. And I needed the time that allowed me to do my exercises. So I always picked to do my exercises at the time of day I had the most energy. So when is that going to be? Everyone can decide that for themselves. When do you have the most energy in your day? That's the time that you're going to dedicate to doing your exercises. Making your exercises that not negotiable thing that you have to do every day was key, and it still is. I mean, I have been negotiating a little bit, but I know how important they are. Like, I know right now that I'm only here because I did those exercises all the time. Now that people might say that I'm better now, well, if I stop doing my exercises, what's going to happen to me? Am I going to go backwards? I don't want to go backwards. I want to keep going forwards, right? I would tell people that being accountable is so important. Something like the MS Gym where you have to be accountable for yourself, right? Like, you are the one who has to press play every day. Nobody's going to do it for you.
It can be really hard to find that motivation during rough times. What are your thoughts on buddy groups?
I know that there's a lot of talk right now in the MOC about buddy groups and joining buddy groups, and they're super important to help you through anything, to keep you accountable. If you're having a problem, they're there to help you through it. Also, to remember that you need to set your goals. So Trevor did a talk about SMART goals before, and it's so like dead on for goal setting. For someone who's been in a competitive athletic environment before, like, those are what you do as an athlete. We're athletes whether we look like it or not. So setting goals and being accountable, having a schedule is so important. Making sure that you're sleeping as well. So you have to give yourself a little bit of grace too. So you're not going to perform, like, this is my athletic side. You're not going to perform well if you're exhausted by doing too much, right? Goes back to Trevor's neural edge. You need to be able to recognize that.
So neural edge is a phrase that is kicked around in the MS Gym all the time. Basically, what it means is that you have a tired brain and your MS symptoms are flaring up. So how do you find motivation when you're really struggling and you don't see the point of pressing on?
Number one, I think, is to keep that why in the top of your mind. Why am I doing this? Why every day? Why do I need to do the exercise? Because I want to get better. But why do you want to get better? I want to get better so I can play with my son. or I want to get better so I can kick the soccer ball, or I want to get better so I can go on a bike ride. Right now, mine is I want to get better so I can play hopscotch. I can't jump for the life of me, but I want to get my hip flexors good and I want to get my legs strong so that I can play hopscotch. Every single time we see a hopscotch on the driveway or the sidewalk, my son will stop and like, come on, mom, let's do it. And he gets off his bike and like does the hopscotch. I'm like, oh, not right now. But I want to be able to do that. I still want to be able to do that. So to have that why, that's your driving force. Your movement prescription is your map. Your accountability is how you are going to reward yourself, right? Like it's just one thing after another, after another. And there's going to be days where you're tired. You don't feel like doing it. And then for me, when I don't feel like doing it and I don't do something, the next day I don't do it because I didn't do it the day before. And I didn't do it the next day because I didn't do it the day before. And I know this about myself now. So I can get into that cycle. I think when you're a mom and you have these little children who are sucking your energy, sometimes it feels like, don't let them suck your energy. It's easy to put it off. But when you get back on, like the exercises give you the energy that you need to help you get through the day, right? So that's why it needs to be part of your schedule.
What would your world be like without the MS gym?
Honestly, like what I can say is that without the MS gym, I wouldn't be where I am today. Trevor has called, there's a couple of new moms in the MS gym, and he'll call them the MS gym babies, the MS gym baby, blah, blah, blah. Well, before we had our talk here today, Jody, I said to my husband, our daughter is an MS gym baby. Like she is. Because without the MS gym, I don't know that she would be here.
Wow.
And how like big is that to say? Without the MS gym, I don't know if my daughter would be here.
Wow. That is really powerful, Melissa. And you are so articulate and well spoken. I feel like I didn't need to be a host today. I felt like you could have just taken the mic and told everyone your story. And it has been so fascinating hearing from you. And like what a better way to end the show than your last comment, like saying, without the MS Jimmy, you can't imagine that your daughter, would be here. And I think that, when Trevor and Misty hear this podcast, they're going to be, I'm sure, well, we all know that Trevor's going to be in tears because it doesn't take much to make him cry. But I'm just saying, like, that's like the heartbeat of him and Misty, what they always wanted, to set people free, and to know that, they played a part in your own freedom and in the expansion of your family. So Melissa, thank you so much for your time today. And you are such an inspiration. I feel so light and wonderful hearing your story, and I know that it will really impact other MS gymmers, whether they're moms or not. Just hearing your perseverance and your go-getter attitude. So thank you, Melissa, for taking time to talk with me today. And I look forward to hearing more and more of your victories. And I will be trying to jump up and down with you when you post that post about doing that hopscotch with your children.
I can't wait. And you know what? I was thinking in the winter, we'll draw a hopscotch with chalk in the garage so we can practice. Maybe by next spring. That'd be awesome.
That's
that
awesome.
would be so awesome. Thank you so much, Jody, for having me on. And I just, we talked at great length today about what I've gone through and how I got here. It's all all or something, right?
Mm.
It's all or something. And we can all get to that next level. We've got to just keep that focus and we'll get there and keep believing. I feel like the belief part is so huge. And you can do all the physical exercises that you can, but that belief piece is the utmost important, because without the belief, you might not get to that next level when you want to, or as quickly.
Mm-hmm.
Thank you so much, Jody. And
thanks, Melissa.
I feel very honored to be able to do this, and I hope that I can help even one person.
I know your words definitely will. So thanks again, Melissa.
Thank you.
Do you want to give a voice to your own story or learn more about the MS Gym? You can check us out at themsgym.com.